Assalamu alaikum. I am Dr. Syeda Farzana Yesmin, Associate Professor Gynae Obst at the Akij Medical College, Khulna. Today's topic is hemorrhage in early pregnancy. First, we should know what are the causes of hemorrhage in early pregnancy. Some causes are related to pregnancy state and some causes are associated with pregnancy state. The causes related to pregnancy state. First, abortions. 95% hemorrhage in early pregnancy occurs due to abortions. Others are ectopic pregnancy, molar pregnancy, ruptured varicose vein, and these are cases related with pregnancy state. Now, we should know the cases which are associated with pregnancy, and hemorrhage occurs due to this association. These associated causes are cervical polyp, cervical erosion, carcinoma cervix, and ruptured varicose vein. As abortions are responsible for 90% hemorrhage in early pregnancy, we should know about abortions. What is abortion? Abortion means interruption of pregnancy before 28th week of gestation. Why we should call it interruption? Because in all abortions, product of conception is not expelled. In case of missed abortion, blighted ovum, the product of conception is retained within the uterus, but these are called abortion because the product of conception is not yet created or not yet seen in ultrasonography, or the pregnancy is not viable. But in case of incomplete abortion, in case of inevitable abortion, product of conception expelled out. So, we should call it interruption of pregnancy before 28th week of gestation. Now, the etiological factor, etiology of abortion, types of abortion, spontaneous abortion and induced abortion. Grossly divided abortion divided into spontaneous abortion and induced abortion. Spontaneous. Another name of spontaneous abortion is miscarriage. Spontaneous abortion may be isolated or recurrent. Isolated means when abortion occurs for only once, and recurrent means when there is history of 2 or more abortions. This is called recurrent abortions. Isolated and recurrent, both abortions may be threatened, inevitable, complete, incomplete, missed and septic. So, spontaneous abortion or miscarriage may be isolated one or recurrent. Both isolated and recurrent abortion may be threatened, inevitable, complete, incomplete, septic and missed abortion. Induced abortion may be legal or illegal abortion, which may turn into septic abortion. Now, the causes, etiology of abortions. Abortions, in case of abortion, cause may be related to embryonic or paternal factors. Paternal or embryonic factors may be responsible for abortion. The common etiology of abortion is commonest etiology of abortion in first trimester or early pregnancy is genetic factors may be responsible. First, genetic factor, then endocrine and metabolic factors, anatomic abnormality, anatomic factors, infection, immunological, thrombophilia, others, and unexplained. So, the causes of abortions: first, genetic; second, endocrine and metabolic; third, anatomic cause; fourth one is infection, then immunological cause, thrombophilias, others, and unexplained. In case of genetic factor, chromosomal abnormality, genetic factors are the first cause of abortion in early pregnancy. Among the chromosomal abnormality, trisomy is most common. Among the trisomy 16 is commonest. Other causes are maybe polyploidy. What is polyploidy? Polyploidy means 3 or more multiples of a haploid number of chromosome. 3 or more multiples of a haploid number of chromosome, 3n, 4n. These are polyploidy. Monosomy, 45x, monosomy. Other causes are structural chromosomal abnormalities, other genetic factors, structural chromosomal abnormalities, which includes translocation, inversion, ring formation, deletion, etc. Other chromosomal abnormalities may be responsible for early abortion. Genetic factors which may be mosaicism, double trisomy, etc., which are uncommon causes. Among the endocrine and metabolic factors, luteal phase defect is responsible in most cases. In luteal phase defect, a deficiency of progesterone, which gives support in case of implantation, maturation, differentiation, this support of progesterone is minimized. So, luteal phase defect. Second cause may be diabetes mellitus, thyroid abnormalities. In thyroid abnormalities, hypothyroidism, hyperthyroidism, thyroid autoantibodies may be responsible. Now, anatomic abnormalities. Anatomic abnormalities, cervico-uterine factors. Cervico-uterine factors includes cervical causes. Cervical cause is responsible for mid-trimester abortion. Cervico-uterine factor responsible for mid-trimester abortion. Among them, cervical incompetence is commonest. Other abnormalities may be Mullerian fusion defect, bicornuate septate uterus, uterine fibroid, and intrauterine adhesion or uterine synecdoche. In case of Mullerian fusion defect, bicornuate septate uterus, the causes of abortion are reduced intrauterine volume, reduced expansal property of the uterus, decreased vascularity, and when implanted on septum, fetus does not get sufficient blood supply, and these may lead to abortion. In case of uterine fibroid, mainly submucous fibroid is responsible for abortion in mid-trimester. When fetus is implanted on a fibroid, then vascularity is reduced in such fibroid, and fetus does not get sufficient blood supply, and viability is in question, and the fetus or the embryo is expelled out, abortion occurs. In case of infections, viral factors, bacterial factors, and parasites may be responsible for abortion. Among the viruses, The commonest virus responsible for abortion are rubella virus, cytomegalovirus, herpes simplex virus, HIV virus, also varicella variola virus. Among the parasites, malarial parasite, toxoplasma, first toxoplasma, that means torch infection. Torch infection is responsible for abortion, early first trimester abortion. Torch, toxoplasma parasite, toxoplasma and malarial parasite. And among the viruses, ureaplasma, chlamydia, brucella spirochetes. Ureaplasma, chlamydia, brucella spirochetes are responsible for abortion. Among the immunological disorders includes anti-phospholipid antibody syndrome, some immune factors, cytokines, immune molecules, and autoimmunity. 3. Anti-phospholipid antibody syndrome, immune factors, and autoimmunity. 3 headings: anti-phospholipid antibody syndrome, autoimmunity, and immune factors. Anti-phospholipid antibody syndrome, the presence of anti-phospholipid antibodies. Which are the anti-phospholipid antibodies responsible for abortion? Lupus anticoagulant, which may be found in SLE, lupus anticoagulant, anti-cardiolipin antibody, and beta glycoprotein 1 antibodies. 3 antibodies found in antiphospholipid syndrome. Lupus anticoagulant, anti-cardiolipin antibody, beta glycoprotein 1 antibodies is enough for the undergraduate students. And details of the antiphospholipid antibody details should be known in postgraduate students. Maternal medical illness may be responsible for abortion. Among them, cyanotic heart disease, hemoglobinopathies are mostly responsible. Premature rupture of the membranes and environmental factors are also important cause. Environmental factors, cigarette smoking, alcohol intake, X-radiation, exposure to X-radiation, irradiation, anti-cancer drugs may be responsible. In case of cigarette smoking, there is formation of carboxyhemoglobin, which is responsible for abortion, and there is lack of oxygen supply to the fetus. X-irradiation is also responsible for such abortion, and some drugs like anesthetic gases, arsenic, lead also responsible for abortion. Among the contraceptive agents, oral contraceptive pills are not responsible. IUCD in situ within the uterine cavity may be responsible for abortion. In some cases, the causes of abortion is unexplained. In such cases, 2 or more factors may be responsible. Today's class is over. We should discuss the individual abortions in future class. So, Assalamu alaikum to all, and thank you for hearing me.